Emily Hughes is the ODMAP Outreach and Implementation Coordinator for the Washington-Baltimore High Intensity Drug Trafficking Area, and currently based out of Baltimore City office. There are 33 individual HIDTA nationwide, and with that being said, the Overdose Detection Mapping Application Program was started there at Washington-Baltimore HIDTA back in 2016. Emily has been working for Washington-Baltimore HIDTA for almost a year and a half now, specializing in ODMAP trainings, demos, implementing a national outreach program, running ODMAP in HIDTA, social media pages, and assisting agencies and users with ODMAP. Please welcome Emily Hughes at this time.
Hi everybody, good morning. I know it's morning where you guys are at. It's currently 1 o'clock here where I'm at, but thank you so much for having our ODMAP team today. And I'm just going to go over a few slides, kind of an ODMAP overview, and then I'll show you a little bit of a demonstration on our system of ODMAP. So to get started, ODMAP stands for the Overdose Detection Mapping Application Program. What is ODMAP? So for those of you who don't know what ODMAP is it's a web-based tool that provides near real-time suspected overdose data to support our public safety and public health efforts, which can mobilize an immediate response to an overdose event. So as you can see from the pictures to the right, you see an iPad, a phone, a computer. The good thing about ODMAP is it's free, it's easily accessible. You can pull it up on your computer, your phone, your iPad, whatever, wherever you're at. So once you have an account, it's really easy to get onto. So with ODMAP comes eligibility. ODMAP is strictly for federal, state, local, and tribal agencies. This is going to include your law enforcement and criminal justice personnel. This is including your public health personnel, your licensed first responders, such as your fire and your EMS, and hospitals with emergency departments. Hospitals do have to have the emergency department to become eligible for ODMAP. So with that being said, when agencies and users join ODMAP, they must sign a participation agreement prior to gaining access to ODMAP. The agreement just outlines all of our policies and procedures. Once that's signed, then on our end, we approve your agency and you have full access. So this is just some ODMAP national engagement that we have currently. We currently have the number of participating states is all 50, including the District of Columbia and Puerto Rico. We have about 5,000 participating agencies. The users within those agencies is over 33,300. The number of states that have statewide implementation is 33. And the number of suspected overdoses that have been entered into ODMAP system is over 2.37 million. So this is just some general facts about ODMAP. Sometimes people get confused after a presentation and have some questions, so this is just a little bit to clear that up beforehand. So ODMAP, as stated before, is not open to the general public. You have to be eligible, you have to be an eligible agency. With that being said, if you are a part of an agency that is not eligible for ODMAP, there are ways that you can still work around that. Say you work for a nonprofit agency, they're not eligible for ODMAP. You can work with a local eligible agency such as the health department, the police department, all that sorts, and you can gain access under a local agency with their permission. ODMAP is strictly for situational awareness. It's not to target any individual. It's not to release any information on a specific individual. It's strictly just for situational awareness to see what's going on around your areas. ODMAP is a mapping tool that does not store addresses or specific information of a person. And ODMAP is full of data presented by different agencies. The data is not allowed to be shared unless you as an agency own that data, or if you are granted permission from another agency to share their data. With that being said, we have something called an MOU agreement. This is going to be an agreement for two agencies to share their overdose data between each other, or to share it out with whatever they would like to do with that. That's just going to give you granted permission to use another agency's data. So those are just a little bit of ODMAP facts. Now I'm going to move on testing site. This is not real live data. This is just dummy data, test data, so bear with me, you're not going to see like any overdose points on the actual map, but I'll show you a little bit of what that might look like if you are an agency that ends up signing up for ODMAP and wants to see the national map. So to start, there are 3 ways that you can enter data into ODMAP. We are currently looking at our homepage. This is what it's going to be like. This is going to be one way that you can enter data, and this is going to be by manually hand entering it. So the 3 ways we have is hand entering it through a form called OD form, which is strictly for our law enforcement. And then the 3rd way is going to be through an API system, which is a automatic record management system, which is going to take the data through the API strictly onto ODMAP, so that way you do not have to come onto the site to hand enter it. So today I'm going to just show you an example of how we are able to hand enter our data. So I'll use my work address that I'm currently at. We're in Baltimore. You can see that this is geocoded. Once this column turns green, it's going to give you your lat and your long. When you come down here, all of these things are optional. So the really cool thing about ODMAP, it's very unique. You only need 4 mandatory data entries. That's going to include your location, your outcome, whether it was non-fatal or fatal, your naloxone administration, and then on the next page, your date and your time. So those are going to be your 4 mandatory entries that you need. This whole section is not mandatory. It's solely up to the person who is inputting this data into ODMAP. The good thing about it is, though, you do have a ton of other options. It's beneficial. You can input their primary suspected drug, of what the victim was overdosed on, any additional suspected drugs, whether or not naloxone was left behind by law enforcement, by EMS, or by a bystander. You can see if it was a multiple overdose victim incident, all of that good stuff. So it's beneficial, but it's not mandatory for our inputs. So after we have our first mandatory location, we want to go down to our outcome, whether or not it was non-fatal or fatal. For this one, I'll say it was non-fatal. We then want to move on to our 3rd entry, our naloxone administration. I'll click on multiple doses. This is going to show you now the next page where your incident date and your incident time is at. This is your last mandatory entry that you need. So we could say it happened September 24th. We'll say 1 o'clock my time. And if you scroll down, this is going to give you a street level point of the address that you have put in, which looks correct. This is where my building is at. And in order to submit the location, you want to click this. And it will come up with another page that will show you that you have successfully created your overdose case on the map. So those are the 3 ways that you're able to input data into our system of ODMAP. The next thing I want to show you guys is our national map. By clicking on this national map drop-down, clicking on the national map, this is going to take you to our live map of overdoses that are happening within the last 24 hours. So as you can see, there's no data points besides the one that I have just uploaded. This is because this is our test site, this is dummy data. If I was showing the live site, you would be seeing overdose points all around the nation. This chart would be different as well. So with that being said, this chart at the bottom left-hand corner, that is a live 24-hour updated chart. You're going to be seeing overdose data that is going to be updated every minute of every day. So you'll be seeing it from 11:16 a.m. yesterday to 11:16 a.m. right now. You'll be able to see the total number of suspected overdoses on the map. You'll be able to see the suspected fatal overdoses on that map, and then the amount with naloxone administration all around that. You will see that there's going to be a bunch of different shapes and colors on the map. As you can see, our 1 overdose point that I just uploaded is a circle, and it is like a pinkish purple. If you go down to this pancake looking icon, you'll be able to see a key for all of what you would normally see on the map. So we like to refer to our circles as our circles of light. Those are going to be our non-fatal overdoses. Our diamonds are going to represent our fatal overdoses. So we have the 2 shapes. All of these colors are going to represent our naloxone administration. So you can see a red diamond would be no naloxone, a yellow diamond would be single dose, green multiple dose, pink naloxone is unknown. So same goes for the non-fatal. So they all are going to mean something different. Another thing you can do on the map is if you zoom in to your overdose case and click on it, we are able to see an incident pop up that is going to show us some information on the case on the map. So as of this case, we can see the incident type, it was a non-fatal multiple dose of naloxone. The incident date and time was yesterday at 1 o'clock. We can see the county and the state it had occurred in. We can see agency that has inputted it. If this is available, the person's information, you can see who has inputted this data. You can see the insert date, so that will be different than your incident date. This is from yesterday. This is showing me that I have just now inputted this into our system. And you can see many other things. This pop-up is just going to show you some information on that case. So with ODMAP, we also have a zoom limit. By zooming in completely, you cannot go past street level. This is as far as you can go. This is for privacy. You can't zoom in to identify the exact location. So on our national map, we have a filtering option. If you scroll down to the fourth icon, this is a way we're going to be able to filter our data. So we're able to input up to 7 states and 7 counties at a time. So if I did Maryland, where I am at, and did Baltimore City, you can actually do up to 7, and then you are able to pick a time frame that you would like to view your data in. So you can view your data in that specific state and county in the last 24 hours, today, yesterday to now, this week, this month, this quarter, this year, or you have the option to customize a specific time frame. You also have other ways to filter. You can do it by the outcome, if naloxone was administered, zip code, primary suspected drug, if there's any additional suspected drugs, if there's any, and multiple other things. So I'm just going to show you how this would work. So once you have your information in, you would want to click Apply Filters. This is going to show me specifically what I have filtered, which is our county in Maryland, Baltimore City, Maryland, and it's going to update my live chart. So it's showing me from the whole entire year of 2024 so far, it's showing me there was 424 suspected total overdoses, 406 of them fatal, and 9 had naloxone administration. This is obviously test dummy data, this is not accurate data, but this is just a way to show you how you can filter on the map. So with that being said, we also have analytics that we can look at on our map. If we come to the left-hand corner, we are able to see a bar chart and a table chart. Our bar chart is going to show us our overdoses by type. As you can see, it's going to show you the same color-coded with our non-fatal and fatals and our naloxone administrations. We're able to see day of the week, hour of the day, suspected overdoses per day, suspected overdoses per month. We can see a county, state line chart where we can drag and zoom, and we're able to see naloxone kits. So these bar chart data is showing me my filter data. If you remove this by clearing our filters, it's going to show us strictly the whole entire map. Underneath, actually before I move on, I do want to say we are able to download this data and share it. By clicking these 3 lines, you can actually download this by an SVG file, a PNG file, and a CSV file. The only difference with our table chart is we are not able to share this data because we do not own it. This is going to be the same exact type of thing that you're going to be seeing when you click on a data point and when it's showing an incident pop-up. You will see there will normally be way more than this because it's going to be showing your specific area. It's going to show you your incident type, the date and the time, the county, the state, zip code, agency name, all that information. You're able to see the suspected drug, if any, additional drugs. So this is just laying out your information on that case in a table form. So next I want to go into our newer features that we just released on our map. This is going to be our custom shapes, custom bookmarks, our spike alerts, our polysubstance and demographic layers, and then our naloxone layer. So first I want to show you guys our custom shapes feature. So normally we will change the color of this background because it's easier to see. You'll understand why when you shade your area. Say we want to look at Maryland again, Baltimore City, and filter for this year. We are now seeing our data for this whole entire year so far in Baltimore City, Maryland. Our custom shapes filter is going to allow us to boundaries. So instead of looking at a straight county and a state, we're able to go beyond that and look deeper into a county. So if we go to our second option on the right-hand panel, our globe, and by clicking this mountain-like filter, we are able to now draw our specific perimeter of an area of interest. So if we dive deeper into a county, and I want to look around, find Baltimore, we can. So as you can see, I've closed my shape. Once it's shaded, that means your shape is completely finished. You then want to click Apply Filter. This is going to be a way to remove all of the other overdose points around your specific area of interest so that you can take a deep dive into crossing county boundaries and looking deeper into your area of interest. So as you can see now, our chart has updated. It's showing the total number is 42 overdoses, there were 40 fatal, and 0 with naloxone. So this is just a way to take a deeper look at your overdose data if you're looking at if you want to pinpoint and look at a specific area of interest. And to piggyback off of our custom shapes, we now can move on to our custom bookmarks. If we come down to this ribbon-looking icon, we are able to now have the option to save the specific area that we have shaded. So I can save this as Baltimore City, example, and that's going to now come down under my bookmark list. So this is going to be a way to go back to this area every time you want to keep looking at it instead of having to go back to our filtering and type this all in again. So let me go to a different one to show you guys. This is another saved bookmark that I have on here if it loads. If not, let's click Emily Test. Well, it is not loading, but normally it would take you to the previous one that you saved, and then if you want to go back to yours, it's going to show you exactly what you just saved. So this is just a way to keep coming back. Instead of coming into ODMAP and having to filter your data constantly, this is a way to come back in and look at your area. With that being said, we now have something called custom spike alerts. I'll get into those later on when we go into spike alerts more. I do want to move on to our polysubstance feature. This is new on our map. Beforehand, we could only see primary suspected drug. This would only allow us to put in 5 drugs at a time to filter by. We now have the option with our polysubstance feature to add any additional suspected drugs. This is allowing us to do an extra 5. So now we're able to put up to 10 drugs at a time when filtering our data. We can also view this by clicking on an overdose point. Like I showed you guys before, we could see our suspected drug. Now we can see any additional suspected drugs. We are also able to view it on our table chart. If we scroll all the way over, we can see any suspected drugs, and over here, any additional suspected drugs. Next, we have our demographics layer. By zooming out, I will show you guys the whole entire country. By clicking on this pancake-looking icon, we can toggle off our overdose points, and we can just toggle on our new demographics layer. Our demographics layer is going to show us demographics based on our counties around the nation. So say I want to click on West Virginia, we're able to click on a county. We can click for demographic summary dashboard. This is going to open up a second link, which is going to take you to some facts about your area and the demographics of it. So as you can see, normally this would load. It would be a picture of the county and the map. It's going to show you your demographic summary. It's going to show you some key facts on your area, such as your population, the household numbers, median age, change median disposable income. You can see educational facts. You can see income facts, household income, and employment facts. So that is our demographics layer. We then have our newest naloxone saturation layer. So if I toggle this off, we can go down to our naloxone. So this is our newest feature that we have. As you can see on this key, it's going to show us areas that are saturated with naloxone and areas that are not saturated. So the dark blue will be saturation, the lighter blue is going to be no saturation. So this layer is examining the amount of available naloxone in a community that's needed to reduce overdose death rates. The saturation is defined as the minimum number of naloxone kits distributed per 100,000 population per month. And the number of kits on the map is the number distributed during the most recent month reported for data. So if I zoom in and just click on a saturated area, it's going to give us an incident pop-up based on our saturation area. So we can see that the state is Michigan, our county, we can see the year, the month, the number of kids in the area, and the saturation level is at a rate of 73.4. So this is going to show us our saturation. If we click on an area with no saturation, it's going to show you the same exact thing, just telling you that there's no saturation. So this is a way to now view naloxone around our areas that we have piloted. We currently have 14 areas that are piloted. And if anyone is interested in becoming a part of this, wanting to see naloxone data in their area, we have recently brought on a naloxone data layer manager onto our team. He's great. He's working really hard to get this up and running. I can always put that email at the end of this as well. So that's our new feature we have. So on to spike alerts now. For those of you who don't know what spike alerts are when a specific area meets or exceeds a number of overdoses within a 24-hour period, which will then trigger something called a spike alert. So if we click on Manage drop-down and go to Alerts, this is going to show us our spike alerts. This is going to be a way to create those alerts. So whenever an area meets or exceeds a number of overdoses in a 24-hour period, you will receive an alert through email, or you can even receive it through text. So let me just show you guys a way that you can sign up for your spike alerts. So if we do Maryland, Baltimore City, we can now see that this is going to give us a recommended spike alert threshold for our non-fatal and fatal overdoses. Our number is showing 3. This threshold is determined by 2 standard deviations above the mean of the last 90 days worth of our data. This threshold is going to continue to update every 90 days. So right now we're currently making a spike alert for the state of Maryland, Baltimore City. If we think this number is too low and we want to be notified when a spike in overdoses reaches 7, we're able to do that. So this is going to be a way to customize what the number that will hit a spike alert for you to receive the alert. We then are able to click to automatically update this threshold. This is going to be, once this updates per 90 days, by checking this, it's going to update and let you know, give you an alert when it hits that number every 90 days when it updates. So to set this up, you then are able to put in your email subject, you can put in your email body, and any subscribers that you would like to add, they do not have to be ODMAP users, they do not have to be signed up. So say I want to sign somebody else up that wants to receive specific alerts, I can put them in my subscribers list and then click create. So that's going to be our way to create our spike alerts. We do have the option for overdose alerts and statewide alerts as well. Our overdose alerts are going to be when someone is notified when any overdose in a specific area is happening. So say you want to do the state of Maryland and do my county, Baltimore City. We are now able to get an alert whenever there is an overdose in the state of Maryland and Baltimore City. We would do the same thing. We would put our subscribers in. If we do want to narrow it down a little bit and just get notified notified when it's a fatal overdose or when it's a non-fatal or both. We can do that as well. Type in your subscribers, click create. Statewide alerts, this is going to be very similar to overdose alerts, but this is going to be any overdose that is happening in your state. So we would just put our state in there, we would be putting in our subscribers, and we would click create. So now our custom spike alerts, this is new. This is going to piggyback all of our custom shapes and our custom bookmarks. Like I showed you before, we saved our Baltimore City example. We are able to take that bookmark and now create a spike alert on that shaded area. So instead of looking at spike alerts in the state of Maryland and in Baltimore City, we can now zoom in and take a deeper dive inside the county and create an alert based on our specific area. So I click my bookmark, I'm able to update this threshold if I think that's too low or if I think it's too high. I can do number 2. I can be alerted if I want it when it reaches 10. Whatever is best for you. We can also click to automatically update this threshold. So if this number changes per 90 days, it's just going to let us know when that number reaches, when the spike reaches that number. We are able to use our custom email subject, custom email body, and we can put any subscribers that we would like into this to create our alerts. So also what we have on our national map is a custom spike alert layer. So we are able to turn on recent spikes and current spikes on the map. So as you can see, our counties with current spikes are going to be shaded with a bright yellow, and our county with recent spikes are going to be shaded in different plethoras of orange. So counties with spikes currently are the shaded yellow. We're able to see what's going on around the nation. By clicking on the shaded area, it's going to show us a little incident pop-up like we've seen before when clicking on an overdose point. This may take a minute, it's just loading. As we can see, we're clicking on a spike that is currently happening in Alabama. It's going to show us when the spike started, which was today at 11:42 a.m. It's showing us it was in Alabama, in St. Clair County. Our threshold number, which is the math that we take the 2 standard deviations above the mean of the last 90 days worth of data, is giving us a number of 3. So there's currently 3 incidents. Once it's hit this number, the highest number of incidents did not go above 3, and the current duration was 1.88 hours. So this is just showing a little bit of information on that specific shaded area. If we go down to our recent spikes, we're able to see that the different shaded colors of orange are going to range from our time period. So we can see 0 to 3 days ago on our map is going to be shown for spikes that are in burnt orange. Spikes that happened 3 to 5 days ago are going to be shown in a peach-colored orange, and then this beige-looking color is going to be showing spikes that happened 5 to 7 days ago. So same thing, we're able to zoom in. We can come to our shaded area. We can click on it and view a little bit of information about the spike. We can see that this is happening in Santa Rosa County in Florida. The highest number of incidents was 6. Their threshold was 4. The spike started on the 21st at 12:12 p.m. and the spike ended on the 22nd at 4:30 a.m. So as we can see, this spike was from 3 to 5 days ago based on the color coding. If you click on all the other ones, it's going to show you the same exact thing. You can just refer to your key for the amount of days ago. We are also able to view the map by looking at counties with spikes only. We can toggle the recent spikes off and just view our current spikes happening around the country. We can also turn our current ones off and toggle on our recents and only see those. So you can do them together or you can do them separately, whatever works for you. With that being said, this is our national map and our spike alerts and our ways to enter data. I do want to go to our ODMAP website just to show how to sign up as an agency and how you can become on board with ODMAP. By going to our website, which is odmap.org, you are able to open it up. It takes you to our homepage. We have a ton of different resources you can look at. In order to sign your agency up, you want to click the Agencies tab. This may take a minute. Sometimes our website is extremely slow. Once it gets onto the next page, you're going to see at the bottom, it's going to say Request Agency Access. It's quick and easy. You just click Request Agency Access. It will take you to a next page that's going to show you some things you have to fill out based on your agency. You will need a signatory to sign the participation agreement for your agency. This person as a signatory just needs management level authority. Once that is signed, you will then have access. So it will take you to this page. You can also view any participating agencies that we have currently active on ODMAP. You can select your state and your county that you want to view, see who's participating. By going down here, clicking Request Agency Access, it's going to take you to the next page, and this is all you have to fill out. Just some agency information, the agreement signatory information, and then you will need an agency administrator for your agency. The administrator that's going to be for your agency is going to be the person who would approve any new users that sign up under your agency. So it's quick and easy. Once a new user signs up, as the administrator, you would just go in and approve them if you would like them to be on it. If not, then you would not approve them. Once you fill out your information, you would click Submit Request. It would be sent over to our ODMAP team. We would exchange our participation agreement, and then you would have access. So quick and easy. Another thing I want to show you guys is we have an ODMAP YouTube page. This is for any users that want to learn more information on ODMAP. We have a ton of videos, explainer videos. It's going to show you anywhere from our new features that I have just went over. It's going to take a deep dive into the specific features. We do have videos on how to enter data, on data sharing, and the privacy and policies that go with that. API videos, any type of spike alert video, how to become an agency, and much more. An overview of kind of what I just showed you guys, and all that stuff. So if you want to check it out, just ODMAP YouTube, and then we do have a LinkedIn page and a Facebook page. It's just named ODMAP if you guys want to check that out. And we give any updates. We shout out people that write an article about us. We do projects with people. We all write that on there. So feel free to check that out. And with that being said, I will stop sharing my screen and open it up to questions if we feel like we have some questions.
Can you hear us? Emily? Emily?
Hello, can you hear me?
Yeah, can you hear us?
Yes.
So I have a question. Being on the Navajo Nation, do you think they would share data from here and within our Navajo Nation, and you were able to pick it up through what you have there?
Yes, so we have a ton of tribal nations. We have federal, state, local. We have all kinds of agencies on ODMAP. We are able to look on the map, see that data. As long as you're an agency that's eligible and you register, you'll be able to see the data on the national map.
Okay.
Any other questions? I figured I'd leave some time just in case, because I know it's a lot of info all at once.
I have a question.
Yes.
So I work for the Transgender Resource Center in Mexico, and just to clarify,
Awesome.
we would need to get that data or get approval through like the Department of Health or some other governmental agency, correct?
Yes, so if you are not under our eligibility, you cannot sign your current agency up for ODMAP, but there are ways that you specifically can gain access. So say you as a user, you want to view the map, you want to see what's going on around you in your area or around the country, you're able to work with a local agency that is eligible and sign up under them.
Okay.
So if you do want to view any agencies in your area that are on ODMAP and active, you can go to our ODMAP website, odmap.org. You would click the agencies tab, and just what I showed you, where you can put in the state and the county, it's going to give you a list of every single agency that is on ODMAP in that state and county.
Okay, thank you so much.
You're welcome.
Any other questions? That's all the questions we have.
Okay, great. Well, I guess I left you guys with a little bit of time.
That is fine, that is good. So appreciate you coming on, and this is a lot of good information. You gotta be tech savvy, I guess, too, at the same time. So.
Yes, and that's why we love to have our little YouTube page. It explains a lot. It goes step by step so you can navigate it. And also, I am always willing to jump on a call. I do trainings and demos. I show exactly what people need to see if they have questions or they want to learn more. So I'm always willing to do that for you guys as well. If anybody registers and has any more questions, you can reach me at ehughes@wb.hida.org. It's on our LinkedIn page, my email, on our ODMAP LinkedIn. So if you have any questions, you can follow up, and I'd be happy to help you. So thank you so much for allowing me to come today and give you guys a little bit of an overview of ODMAP.
Can you say your email address again? ehughes?
Yes. Do you want me to put it in the chat?
Yes.
Perfect. I'll put that in there right now. Let me know if you can see that.
Yeah, we can see that.
Awesome.
Thank you.
That is my email, and then if you guys have any questions, feel free to reach out, and I'd be happy to help.
Appreciate it. Have a good day.